Joining us now is Africa 54 health correspondent Linord Moudou with a coronavirus update. Hello, Linord.
Hello, Esther. Hello, everyone. The World Health Organization says deaths from the coronavirus epidemic have surpassed 1,000. The development comes as some 300 scientists, public health agencies, ministries of health, and research funders convened for an expert two-day meeting at the WHO to share the latest information about the virus and decide how best to confront it. According to the WHO, there is no vaccine to protect against the disease and no proven therapeutics to infections. China is reporting over 42,000 confirmed cases. During a visit with coronavirus patients at a Beijing hospital Monday, President Xi Jinping called for more decisive measures to contain the outbreak. China's central bank is making $43 billion available to help businesses involved in fighting the epidemic. Health experts say the spread of the coronavirus may ease in warm weather when people get out of doors and are not in such close contact with each other. But this is a new strain of coronavirus, and some of the experts believe it is not too soon to say if spring and summer will kill it off. Now, health authorities in Africa are scrambling to prepare for a potential outbreak of the coronavirus. In South Africa, health officials say the country is taking preventive steps to ensure that the virus does not become a national threat. Professor Cheryl Cohen, co-head of the Center for Respiratory Disease and Meningitis at the National Institute for Communicable Diseases in South Africa, explains.
In South Africa, really, we have been closely monitoring the situation right from the first small reports of cases in Wuhan, and really we've seen the evolution of this to be really a global situation. And of course, as part of that, we've been really stepping up our preparedness in the event of an outbreak. And really the first thing we did was issue guidance to clinicians in terms of what is the case definition and what are the signs and symptoms to look out for. And then, really having practical processes for isolation of cases, treatment of cases, and guidance on making the diagnosis. And also as part of that, really strengthening the surveillance at the ports of entry, which we know is not 100%. People can be incubating and still come into the country, but that's also an important part to try and collect or identify cases early. I think another really important part for South Africa was getting our laboratory up and running to do the diagnostic test. And obviously in the early stages of an outbreak like this with a completely new virus, there aren't just tests that you can buy off the shelf. We were very fortunate that some laboratories quite early developed a test and published that test, so they made the procedures available. And then our lab worked really hard, overnights and weekends to get that protocol and then to procure the reagents and validate the assay in our laboratory. And I think it's really helpful that we have this assay running in country so that we can provide a rapid diagnosis and exclude, possible cases, which is really helpful.
That's our health report for today. To stay in touch, find me on Twitter @Linord Moudou. Esther?
Great reporting as usual, Linord.
Thank you.
Thank you very much.